Currents News is committed to telling you everything you need to know about the coronavirus crisis. Each Friday, starting today, we'll bring you the best medical advice so you can better cope with the disease. Joining me now is Dr. Robert Tabali, an infectious disease expert with the Catholic Medical Association. Welcome, doctor.
Great to be with you today.
We keep hearing the virus can stay on surfaces for quite a while. So how do we remain safe, especially in terms of things like our mail, our groceries, anything like that?
Well, one of the things you'd want to do is that if you get delivery of packages and so on, unless you know the people the vendors that are dropping this off, you'd want to try to take them out of any cardboard carriers outside your home if at all possible. Uh, the virus lives on paper and cardboard for at least 12 to 24 hours, on inanimate surfaces for up to 7 to 9 days. And recently we found that on the cruise ships that there was virus reconstitutable after 17 days
Wow.
with the shipping empty. So.
Boy, and along the same lines, we're here in New York City. If a person has to take the subway or the bus to work, do they need to wash their jackets and their clothes as soon as they get home if they're sitting down or leaning against anything?
Well, unfortunately, that type of mode of transportation really could carry the coronavirus. You'd want to wear gloves if you could, leather gloves or something that's not permeable. Plastic or vinyl or latex type gloves would be another option to use. If you do have access to sanitary wipes, you'd want to use that to clean off the surface if possible before you sit down. That's always a good suggestion, even not in the age of coronavirus. But
Okay.
if you have a spray germicidal when you get home, something like Lysol or something similar to that, you could use that on your clothes as well when you get home.
Okay, now what do you say to parents who are concerned that if they come down with the virus, they won't be able to care for their children, especially babies and toddlers? What do you do about that?
Well, I would want to reassure parents that if you come down with a virus, you are at greater risk than your child or toddler is. That may not be a source of comfort, but in a parental sort of way, you can be reassured that your child, even if they do contract this virus, they usually have a very, very mild illness with it. And in the series of published cases of children who have gotten the virus in very large numbers, it's been very uncommon for children to require medical help to begin with, and those that do usually do extremely well, unless they have severe congenital cardiac problems or severe pulmonary problems.
Now we're told people with the virus, may not everybody may get sick. They just might be carriers of the virus who could still infect others. So what should we do if we hear a coworker or someone at our kids' schools had tested positive for the virus?
Well, what's been done cannot be undone. If your child has come in contact with someone that is infected with the coronavirus, you just have to watch them closely. Again, as long as your child doesn't have any serious medical problems, even if they do catch the virus, they will likely do extremely well. If your child has asthma, brittle asthma, has diabetes, poor control of their blood sugars, you definitely want to try to take care of those as much as you and keep them controlled as much as possible. But your child would likely do well.
Okay, Dr. Robert Tabali, an infectious disease expert with the Catholic Medical Association. Thank you for joining us today.
My pleasure to be with you. Thank you.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.